What are the various things that patients can incorporate into their lives post chemotherapy? Unfortunately, chemotherapy has a very toxic impact on the body. And while chemotherapy is important, the side effects of chemotherapy and the lasting side effects of chemotherapy can be quite extensive. The best way to deal with these side effects are, number one is the kind of nutrition that a patient should start ingesting after they have gone through the bout of chemotherapy. They need to detoxify the system. So a lot of fresh vegetables, salads, increasing the fiber in the diet, having a lot of fermented and high probiotic foods, even taking a probiotic supplement is all recommended for a patient who is post-chemotherapy. Second is physical therapy and physical rehab. All patients should get back into incorporating movement into their regimen. This helps the digestive system, this helps flushing out toxins again, this helps in starting to rebuild the immune system, rebuild bone density, and also strength and eradicate or reduce fatigue that chemotherapy could have caused. And number three is very much so managing the mind, the mental health, the emotional and mental distress that chemotherapy and that treatment could have brought to the patient. So connecting with a professional counselor, investing your time into things that can manage the mind better, that can bring more peace of mind, indulging in activities that are more mind-body therapies, such as, a yoga practice, that could also be sound therapy, hypnosis, and various different activities that can really start being able to manage anxiety better, address things like depression, fear of relapse, getting back to normalcy, and a healthier version of you post